Hey, good afternoon, guys. This is Gabe Roberts from Back to Nature Lifestyle Medicine, health coach, health entrepreneur, board recognized diplomat in nutrition. Today, I just wanted to go over some of the underlying causes that are responsible for heart attacks and strokes. Now, there are a couple of others, low vitamin K, things like that, but I do want to address the ones that are not so apparent and the ones that have no correlation with medicine, okay? It's very apparent if you just research John Warner, November 2017, practicing cardiologist from Austin, Texas. He had all the family history of heart attacks, strokes, and on a Sunday he was sharing this with the entire room conference full of cardiologists, letting them know that he had the risk factors, family risk factors, etc. And on that Monday he has a heart attack and actually has 2 stents put in after a major British medical journal said that stents are actually useless and carry more risks than they are benefits. No, I didn't say that. Published literature did, British Medical Journal, okay? But today I want to go over some of the underlying causes that are responsible for, again, heart attacks, strokes, which occur every single minute in the United States. So I want you guys to take this to heart. Number of stairs, I have that in a box there by itself because you can figure out how strong your heart is by how many stairs you can climb without getting winded. If you're carrying a sack of groceries or something heavy, you won't make it up 3 fleets of stairs for your arms give out. That's because you're plugging up. And that's a very, very classic sign that your heart is not doing so well, despite what the cholesterol numbers and all that stuff might be. So, number one I want to talk about is called elevated C-reactive protein, and this is a scale 0 to 3. Acute phase proteins that increase with systemic, 2 I's here, inflammation or infection, okay? Standard American diet, if you're eating standard American diet, which is not good grass-fed meat and high level of good quality vegetables, if you're eating just the regular stuff, you're going to be exposed to the wrong oils and you're going to have high levels of inflammation. So everyone that eats standard American diet has excess inflammation. Infection, I've talked about that many times, okay? If this is elevated above 3, you need to sort this out and see exactly where this is coming from, what's causing it. Because this is much more dangerous than any cholesterol thing and will plug you up very quickly in your heart, in your brain, etc. Okay? Again, scale 0 to 3, we have lots of people come in that have been to several doctors and they are anywhere from 10 to 40. We've seen up to 45 on CRP after they've been in the Mayo Clinic 3 times. Just think about that, okay? If you think you're gonna get this resolved with a drug, daily aspirin, anti-inflammatories, I'm sorry to tell you that that's not going to help the case at all, okay? Excess homocysteine, again, this is a sign of a methylation defect. Anything above 10 can cause blood to clot more easily than it should, and the risk of blood vessel blockages starts to increase. This one's a lot more sneaky. This one can actually start to increase without even showing any kind of symptoms, signs, blood pressure increase, anything like that, and very dangerous. Homocysteine should be recognized, respected, and regulated to where it's healthy numbers anywhere below 10, okay? Some lab scales show up to 15. I will tell you that I do know of people that have had heart attacks and strokes at 11, okay? This is getting a lot of attention lately with doctors. Classic sign of methylation deficiency, so you are not converting B vitamins correctly, okay? It's getting a lot of attention from doctors, and I mean functional medicine doctors, not standard medical doctors, because this cannot be corrected with drugs. It has to be corrected with nutrients, and someone has to know how to apply these nutrients. If your nutrients aren't providing it, I would suspect that you have an MTHFR issue, and that's starting to get a lot of attention. I know Dr. Ben Lynch is big into this, and as well as Dr. Brownstein. They understand this factor very well. They've got some wonderful books out there. You can just Google this stuff and YouTube it to understand more in depth what MTHFR is. We see quite a few of these people as well. Excess fibrinogen, okay? Anything above or below this range is going to demonstrate how well your blood is going to clot or not. Think of fibrinogen as wire mesh, pieces of wire mesh floating around your blood. And if you get a cut and it starts to bleed out, these wire mesh start to actually build up and form a clot and actually prevent the blood from bleeding out. So if you have an excess amount of that, think about it, you can clot very easily anytime there's a breakage in an artery or things like that, and that can actually cause strokes or heart attacks. Too little of fibrinogen, and you can be an excess bleeder. You can bruise very easily, and again, that can cause a lot of problems as well. So you want to keep within this range, and you want to know exactly how to treat this nutritionally. Excess lipoprotein A. This is my favorite one. Why? Because it gets missed by everyone. Most people have no clue on what to do with this. This is 10 times worse than LDL, okay? And when I say it's my favorite one, it's because I love seeing people change when you start to treat this one. Their memory improves, they start to feel better, they have chest pains that come and go even after they've had heart attacks, they've had stents they've put in. That is a classic sign. If you have chest tightness, angina, shortness of breath, okay? Those are all things you need to get this LPA ran. People will not run this because they have no idea what to do with this. Again, 10 times worse than LDL. Elevated lipoprotein is a strong risk factor for patients with coronary heart disease. It's inherited. So this is purely genetic, okay? Inherited abnormality for plaques, blood clotting, abnormal artery constriction. That's what I just talked about. Weird chest pains. I did have an athlete come in here who's actually younger than myself, and he had lipoprotein A that was above the hundreds, and it was actually interfering with his head. He jumped into a swimming pool and could not tell if he went up or down and started swimming towards the bottom. That's when he came in and we started dissolving this out of his head. So this can affect you anywhere, and it's a high risk factor, okay? His mom had the same thing. Why? Completely genetic, okay? Lipoprotein A accounts for most heart attacks in men and women in their 40s and 50s. This gentleman that came in actually is an athlete. This is in slender, healthy looking people. Healthy people have heart attacks and strokes. You want to get this looked at, okay? And a healthy number is going to be under 30. On top of that, I do want to emphasize, if you're a fitness guy and you're in the gym a lot, fitness does not equal health. Gym fix, okay? Just one of the athletes who ran every day and said that all you have to do is eat clean. And he ran every single day, and his heart plugged shut. He dropped dead in Central Park. Fitness does not equal health. You want to keep that in mind, okay? Now into the more obvious ones, okay? And these are the ones that you can actually fix on your own. Excess triglycerides, LDL, low HDL, low good cholesterol, okay? Long story short, you're eating way too many carbohydrates, way too many comfort foods, okay? Breads, grains, wheats, cereal, chips, crackers, rice, high fructose corn syrup, all those things that are in your diet, okay, everywhere, will cause high amounts of triglycerides and LDL, and they can plug you up, okay? You want to get a good diet of meat, vegetables, and high amounts of fat. If you're eating a good amount of meat, vegetables, and fat, you're going to be satisfied and you won't be craving this. Now, low HDL is usually a B vitamin deficiency and a lack of exercise and a few other things. Some B vitamins can actually flip that pretty good. If you are, excess insulin, high glucose, again, comfort foods. If you are addicted to eating bread, grains, cereal, sugar, chips at night, I will tell you the underlying source is pain, okay? Not necessarily physical pain, but emotional pain. And you need a good health coach to help you unwind and untangle and find those emotions and help you resolve those and help you clear those emotions out before you can move forward, okay? If you're craving comfort food, there's a reason why. You're suppressing some kind of underlying emotional pain. You want to get with someone that can help you recognize that and clear it out so this does not become a disease, okay? Low vitamin D. This should not be a problem right now with the amount of sunlight that we're getting. Get out in the sun 2-3 times a day, 15 to 20 minutes, okay? There's a thing in your blood called squalene. And in the winter time, people's cholesterol often goes up because they're getting less sunlight, okay? When you go out in the sunlight right now, the sun hits your skin, it converts that squalene into vitamin D. Without the sunlight, that squalene actually gets converted to cholesterol, okay? So you want to get in the sun, keep your risk factors down. And again, vitamin D is your #1 prevention of cancer as well, okay? It's your #1 bang for the buck vitamin you can get. And right now, everyone should be getting adequate sunlight. Now, if you get out in the sun a lot and you are still having low vitamin D, you're probably low on essential fatty acids. Get some good tuna oil, things like that. Do not get cheap ones from the low bottom of the barrel, Costco oils, things like that, because they are not what you want. You take a rancid fish oil or something of low poor quality, you're gonna wish you did not, okay? You wanna know how your company processes these oils. It's very important. Low testosterone, another major problem with the men today. In fact, where are the men? Where are the men today? Do you know it's proven today that women have a stiffer handshake than men? That should make you guys cringe, okay? Big problem. Men are not able to clear chemicals. Actually, no one is. That's why people are puffy and kids are big and puffy. And a lot of males today have lost their ability to be men because they cannot clear simple xenoestrogens that we're exposed to, whether it's golf course, lawn sprays, chemicals, plastics, estrogens, shampoos. A number of these things contain xenoestrogens or estrogen mimicking chemicals. And if your detox pathways are not fully open, they're going to stick with you and cause you to be depressed, pessimistic, loss of libido, crabby. You know, you just can't be happy about things. You're going to sit in a corner. You're not going to want to have that fire, that spunk that men are supposed to have to protect the tribe, okay? Andropause symptoms, same thing, okay? Because your detox pathways are blocked and you're not able to fully clear these chemicals out. It's a big problem in men today. And I know that because you should see the testosterone levels. 1600 to 400 is the range. Men are coming in the 40s today, in the 40s. Sterilized, absolutely, completely pulverized because of these things in their environment they can't clear. So I hope this helps. If you guys have any questions or concerns or want to get these numbers ran and know what to do, feel free to get a hold of our office, Back to Nature Lifestyle Medicine, functionalmedicinekc.com, okay? To truly get back to your vibrant state of health, you have to get back to your roots, you have to get back to nature, you have to truly know how to love yourself. Thanks for listening.